and welcome to our healthcare forum today. The title of our forum is Challenges and Opportunities for Healthcare Reform, and we're very honored to have Governor Michael Leavitt here, as well as a distinguished panel. The way the event will work today is we will first be addressed by Governor Leavitt until approximately 11:45, and approximately 11:50 we'll begin a panel discussion. Each of our four panelists will present their ideas and suggestions, followed by a question and answer from the audience. There will be people walking around with blank pieces of paper so you can write down questions that you may have, and they'll be also walking around collecting those questions once you've filled those out. So think of questions that you have that you would like the panelists to address, and they will get to as many of those as possible. Now for introduction for Governor Leavitt. Michael Leavitt is the founder and chairman of Leavitt Partners, where he advises clients in the practice areas of health, environment, and trade. In previous roles, Leavitt served in the cabinet of President George W. Bush as the administrator of Environmental Protection Agency and the Secretary for Health and Human Services, and a three-time elected governor of Utah. Governor Leavitt grew up in Cedar City, Utah, where his upbringing was rooted in the values of the American West, with its emphasis on hard work and common sense. He earned a bachelor's degree in business while working in the insurance industry. In 1984, he became the chief executive of the Leavitt Group, a family business that is now the nation's second largest privately held insurance brokerage. Governor Leavitt, we're honored to have you here.
I am delighted to be back on the campus. I was telling President Holland it is a robust and exciting place. And I congratulate you, the student government, and all of you in the student government, as well as the students and President Holland. Congratulations to you. We have been friends for a long time, and I have great admiration for you and have every confidence that the institution is going to flourish under your leadership. Well, I hope you're here from class and that you brought some paper, because we're going to make this I want to outline for you what we're going to spend the next 45 minutes or so talking about. We'll then have a panel where I hope we can have a discussion. I hope that some of what I say today will be provocative enough that it will generate some discussion. I'd like to have you write down, if you will, 3 major questions that I would like to address today. The first question is, why does this matter so much? It is preoccupying the public debate. We have been focused on it now for almost a year. It's hard to remember a time when the country has been more divided. Why does it matter so much? Second question is 4,000 pages of legislation. How can we boil that down into an understandable set of queries? Well, I would like to suggest that there are 2 overriding questions, and I'd like to frame those up for you today. The third major category of our discussion today will be 4. That's confusing, isn't it? The third is 4. But let me just say item C will be 4 problems that we have to solve in order to get to the bottom of this dilemma. So let's go back to the first item, which is why does this matter so much? Well, can we just acknowledge that this is health, and everyone's health matters to them and to other people who love them. The desperation of pain and the limits of our own mortality is something that fundamentally link us all. They are emotions that are the most basic, and so when you're talking about health, you're speaking a universal language, and it's something that is both intuitive and absolutely spontaneous in people. So let's acknowledge that there is a humanity about this conversation that makes it important. Having said that first, I would like now to talk about what I believe also is energizing this debate now and will continue to energize it in the future, and that is the economic imperative that now confronts us. And I would like to talk about that economic imperative in the context of history. I'd like to focus on a different country than ours, and that country is Argentina. Why Argentina? Well, if we were to go back in history 200 years, we would see that France was the #1 economy in the world. Roll forward to the 20th century, the dominant economy in the world was Great Britain. It had changed in the ensuing 100 years, but vying for #2 were two countries. The first was the United States of America, and the second was Argentina. Perhaps we should think for a moment about Argentina, because we know what happened in the United States, but in Argentina, something went wrong. Well, I would suggest to you that there are three things that went wrong, and I'll talk about those in a moment. But what caught my attention some years ago was a fascinating set of things that were occurring in Argentina. This would have been about the year 2000. I was governor of Utah, and I was interested because I began to see the Argentinian government rolling back pensions. They were cutting the pay, if you will, of a significant number of people in their country. These pensions were not just passed by their Congress. These were constitutionally protected pensions. They were also essentially raising taxes at the same time. They were retooling their tax system because it didn't collect any money. And they had a problem. And I thought these are the most courageous political figures I have ever observed, because they were doing it in the context of a national election. Now, you don't have to be a political science major to figure out that raising taxes and cutting pensions in the face of an election is a tough political choice. Well, I was in Argentina, and as things occurred, I had a day with the president of Argentina, President Menem, and two of his ministers. So I began to question them about this instance, and they began to teach me. And what they taught me caused me to understand that this really wasn't about courage. It turns out that in the nearly 75 years before that their government had come to understand that if you wanted to keep power, what you would do is vote pensions for those who were older, and then a bigger and bigger share. In fact, over time, their Congress equivalent had voted pensions for themselves and for enough people that 60% of the entire country of Argentina was either on a pension or working for the government. Now do the math. 40% supporting 60%, you've got a problem. The second thing they did was they weren't collecting enough money for that. And so they began to borrow money. They didn't borrow it from the banks. They borrowed it from the International Monetary Fund. They borrowed it from the World Bank. They borrowed it from anyone who would loan it to them. And over the course of a 25 or a 30-year period, they built up a fairly sizable debt. It was their second mistake. Their third mistake was that at some point in time, the world began to say to them, we're a little nervous about this. We're not sure we're going to get our money. And the first thing they started to do was to raise their interest rates because they were a bigger risk, and that made their economy less competitive. And then at some point they said, we're going to give you an imperative. Either you stop what you're doing and correct this problem, or we're not going to loan you any more money. The third mistake is they just kept doing it. While others in Latin America began to change, Argentina did not. So by the time they got to the end of the 20th century, where they had started out as the #2 economy, tied with the United States, by the end of the 20th century, they were no longer in that position. In fact, they were in the place where the banks were saying no more money. Well, now they're back to the wall. They had to change. Their political leadership stepped up, began to do the things that had to be done. They were going to trim the pensions. They were going to they were going to raise the taxes necessary to pay for it. And it was just too hard. Now, some of you will remember that during a period right after 2000, they ended up having 5 presidents in 5 years, or 5 months rather. Why? Because every time a new president would come into place and look at the problem and say, I've got to solve this, and start to do things, there would be political unrest. People would simply say, look, you're not cutting my pension. I signed up for this. I worked for it. It was too hard. So they did about the only thing that a country can do in that situation. They started printing money to pay for their old debts. So if you're printing new money to pay for old debts, the economists in this group will tell you you're going to get one thing. What is it? Inflation. And boy, did they get it. They had 5,000% inflation. They had people who were packing money around literally by the wheelbarrow to buy a loaf of bread, and it was literally becoming valueless. They had rampant inflation. They had big-time unemployment. They had social unrest, and their political system essentially began to collapse. Now, why do I tell you that story? We live in the land of the free, the home of the brave. There is not a person in this audience who can remember any time when the United States was not number one in the world economically. But it is time we began to ask ourselves the question, are we making any of the same mistakes that Argentina made and that other great economies before them have made? Let's ask ourselves the question. Do we have constitutionally protected pensions? No, we don't. But we do have Medicaid, Medicare, and Social Security, and they are dangerously moving toward insolvency. And while they are not constitutionally protected, just try and change them. We now have a deficit that is approaching $10 trillion over the next 10 years. We're approaching a health care bill that would add $1.7 trillion over time to our national expenditures. There's argument about how much that would add to our deficit, but it does not argue about how much it takes out of our economy. My point is, and you understand, that we are moving toward a very dangerous time. Now, let me ask the question. Now, let me tell you another part of this story. We're not borrowing money in our deficit from the World Bank or the International Monetary Fund, are we? But we are borrowing it. From whom are we borrowing? I can hear it on your voice. We're borrowing it from China. We're borrowing from Japan. If you take China and Japan, between the two of them, it's almost 54% of our debt. Now, I was in Beijing in December of 2008 as part of a series of meetings we called it the Strategic Economic Dialogue. Not a lot was made of this in the media, but every 6 months, a handful of the president's cabinet would go to Beijing, or a handful of ministers from the senior government ministers from China would come to the U.S. We would go into a small room, we would lock the door, and for the next 2.5 days, we would talk about our relationship. The most powerful economic force and the most powerful demographic force in one room. In December, the vice premier of China looked me in the eye and Hank Paulson. Remember, at the time, we're at an economic crisis in the United States. And he said words that sent a chill down my spine. He said, "We're getting worried about our money. We don't see you doing anything to solve the problem that you have with the entitlements that you are dealing with. And if you don't change it, your capacity to solve that problem is going to cause you to just print more money, and then our money that you owe us will be worth less because of inflation. Give me some comfort. It wasn't lost on me that the day after Hillary Clinton was confirmed as Secretary of State, that her first international trip was to China. And the message was, we're good for the money, keep loaning it to us. It ought not to be lost on you that during our last bond sale in the United States, or in the last couple of months, that the Chinese have dramatically diminished the number of our bonds that they purchase, and that in order to make that sale, the government is essentially buying some of its own bonds. Now, that to me sounds like we're following a pattern that ought to be all too familiar historically. How does this deal with health care? Health care and the entitlements around health care are becoming bigger and bigger part of our national budget. In 1965, 67% of our entire national budget was available to be used for national defense, for higher education, for highways, for everything other than interest or entitlements. 67%. Today, we're down into the low 30%, and it will tumble over the next several years. We are eroding our capacity as a country to do anything but pay medical entitlements. We are following a path that is well known to history. We have seen a pattern over the course of time where sovereign nations work themselves into a debt position where they become insolvent. Now, it also ought to be not lost on anyone that Greece is now, because of its debt, proving to be insolvent. Here's the bottom line. My generation, with the debt that we're accumulating, will be sowing you into a pocket that you can't get out of unless we start soon to change it. And this generation that's represented among these students need to begin to speak out on this issue. Today, when you enter the workforce, you'll be spending about 23% of your entire budget for your health care and your share of someone else's. But there is a collision of demographics and economic reality coming, because my generation is moving into a period where more and more of us are going to be gathering those medical entitlements. Today, there's 12% of our population that's over 65. By 2028, there will be 20%. Today, you're paying 23%. In order to do that on current rates, you'll have to be spending 41% of your entire income. Now, this is 18 years from now, so this will be a point, if you're 20 years old today, you'll be 38. Believe me, that's not very long from now. You'll be spending 41% of your entire budget for health care on your family and your share of everyone else's. Now, that will not work. So this is important because it is not only a humanitarian imperative, we're dealing now with an economic imperative. We have to solve this. Now, I want to speak with some optimism before we go too much further with this somewhat pessimistic view that I believe our country will stand up to this. But we have to deal with some very basic questions. So let's go to subject number 2 that I lined out and ask the question, so what are the basic questions that we have to solve? May I suggest that there are 2 overriding policy conversations that we're having as a country. The first is, just how much are we willing to pay? And the second question is, what role will the government play in making those decisions? Let's deal with the first question. I was at a hospital not long ago dealing with the management of the hospital, and we were talking about a particular type of cancer. It's an aggressive, fast-moving form of cancer. When you get it, it's bad news. In fact, if you're untreated, your life expectancy would be between 4 and 7 months. However, there is a capacity to treat this cancer. And on average, if they're aggressively treated, the average patient's life will go from 7 months at the top end to 17 months. And there's a chance that you just might live beyond that. Now, the dilemma here is that the average cost to treat this form of cancer at this particular hospital was $278,000. Now, for whatever reason, it began to trigger in my mind a sort of self-conversation. I thought, if someone said to me, here's the deal, 7 months or 17 months, but you have to come up with $278,000. Will you do it? Well, I have to admit that it'd be hard for me, but I'd do it. I'd find a way to do it. I would sell my cars. I would mortgage my house if I had to, but if you could give me another 10 months with my grandchildren and to be able to do all the things on my bucket list, I'd do it. Then it came down to the question in my mind, so here's just because I would choose to do it, or maybe I could find a way, or you would choose and you could find a way, does that mean that we are all entitled as a right of our citizenship, that everyone can have that $278,000 to extend their life for 10 months and to have a chance, 1 or 2%, they could go beyond that? That's the hard decision that we're having to make, because when you add up everyone having that right of entitlement to that almost unlimited care, the cost of it makes us Argentina. How much can we afford? We're making a hard decision about that. Now, the second question. What role should the government play in deciding that? It's one thing for me to decide that I'm prepared to sell my cars, or I'm prepared to empty out my bank account, and I'm prepared to do other things. For me to make that decision, what role should the government make that decision for me? This really gets down to a question of what the role of government is. Can I suggest that there are a lot of different roles that government plays in our life? And there is nothing unreasonable. In fact, I would say it is an imperative that unless government is involved in restructuring the healthcare system, we can't do it. So government's got to play a role. What is the role? Well, people ask the question, is healthcare a necessity? Or is it a right, rather, or is it a privilege? I would argue it is a necessity. And we don't have to have that false choice between privilege and right. It's a necessity. And there's nothing unreasonable about a government stepping in and helping its citizens have access to the necessities of life. So it is a legitimate role for the government to play somewhere. Let's look at other things the government might be doing as a means of being able to decide which role that should be. Let's take another necessity. Let's take food, for example. We all like to eat several times a day. We need it to be nourished. We need it to be productive. Therefore, it is reasonable that we should live in a nation where we want no one to starve. And in our country, we have adopted policies that will assure as best we can that no one starves. Now, there are people who eat imperfectly. There are people who don't have as much as they'd like, but it is not our public purpose to let that happen. And so we have organized, using our government as the tools to do that, a series of things. For example, we have policies that make certain that it is abundant and inexpensive. We have an agency that regulates its safety. We have a program that if you can't afford to buy it, then we'll give you food stamps. We will subsidize it. But even then, we expect you to go to the grocery store and pick it up. But if you can't, and you can't fix it, then we'll organize Meals on Wheels. Now, there's a situation where we as a country have used government as a means of organizing a system where efficient markets can operate and where they are fair. Now, let's take another basic need we have, and that is security. We have a security need in our country because, like every other generation, like every other nation, we have enemies. We have people who would take advantage of us, and we need protection from them. And therefore, we organize as a citizenry to do that. And it would be a bad idea if we had competing militaries. So we form one, and we have chosen to have the government pay for it through taxes. The government decides who will lead it. The government decides how much we need and who will deploy it. So here we have two separate needs. We have food and we have security. And we have government playing a role in each. The question is, should health care be more like food, where the government organizes a market and people exercise their own judgments and make their own priority decisions, or should it be like security in the military, where we use taxes to spread the risk and the government makes all the decisions? Those two questions, how much are we willing to pay and what role should the government play in framing those up, are the big conversations that we're currently having. Now, one of the things that is very clear about the current legislation is that it is a very large step toward a healthcare system where the government has a very large role. And that is a change. And we can talk more about that in the panel, but I just want to frame those two questions up. Now let's go to the third area that I wanted to talk about, and that is, what is it going to require to fix this? Now, this is a big conversation, and we'll have more time to talk about it in the panel. But can I just say the first one that I'm not going to take a lot of time on today is we do need every American to have access to an affordable insurance policy. And the question is, going back to what's the role of the government, is the role of the government to provide the insurance and to have the government using taxes as a means, or is it the government's role to organize an efficient market, more like food, where everybody can buy it, but they have to make some choices and they choose some of their own priorities? I'll just editorially say I'm for having the government organize it, not own it. And I will say that I think government's strong hand has to step in. So those who say government shouldn't be involved are wrong in my view. Government has to be involved, but government ought to be using its power to organize an efficient market. But let's set that aside now for a moment and look at the rest of the economic sector we call health. We often call health a system. We say it is a healthcare system. I would challenge that and say we don't have a system. What we have is a sector. We have a large, rapidly growing piece of our economy that is involved in health, but there's nothing about it that would qualify as a system. And there are three additional things that I believe have to be solved. Let me take number two. First one was we've got to get everybody insured. The second is we have to solve the problem of what I'll call silo syndrome. Now, silo syndrome is, in my judgment, a feature of the fact that the entire system is built in silos and there's no coordination. Just think for a minute, if we were to impose the healthcare billing system on the automobile industry. Now, you'd walk into a car dealership and you'd say to the dealer, I need a car. He'd say, I can see you do. Pick one out and we'll send you the bills in a little while. So you'd drive one off the lot, and 2 or 3 weeks later, you'd get a bill from the chassis maker. And then you'd get one from the tire manufacturer. And then you'd get one from the people who made the windshield, and then you'd get one from the car dealer. And the car dealer would say, now you were in the showroom for a while, and then you went to into the salesman's office, and then we gave you a cup of coffee, and you thought it was for free, but it's really $21.97. And it'll be a long list. You won't understand much of it, but we expect you to pay it. Now, how different is that than being able to buy a car today? Today, if you go in, there's a sticker price. It says $23,917, and included in that is a steering wheel. Somebody negotiated with that steering wheel manufacturer to say, we got to have steering wheels so we can deliver this thing at $23,000, and you can compare it. My point is that everything in the healthcare system is disconnected and no one is coordinating. It is like having an entire army of general contractors who are trying to build a house or trying to build a car. So the first thing we have to solve is siloed syndrome. We've got to begin to develop a system of integration and coordination. Otherwise, and competition, I might add. I think we've got time. I'll tell you one other story. I'm in my late 50s, 59 years old. I had to go to the doctor to get one of those over 50 tests. We're talking about the colonoscopy here. I had one about 5 years earlier. I went in, gave him my insurance card, and just endured the rest. That's all I remember about it. This time I thought two things have changed. I'm now the Secretary of Health, and I had a health savings account, which I had signed up for, where it mattered to me how much it cost. And so I called up two places in Washington, D.C., and I said to them, how much for a colonoscopy? We don't know. I said, what do you mean you don't know? I just need to know how much it costs. Well, okay, we can't tell you. That's not the way it works. You come in, bring your insurance card, we'll take care of it, and we'll send the bills to your insurance company. Well, that felt just a little unsatisfying to me. So I thought, I'm going to make this a little field trip, and I went back to the office and called a bunch of doctors around me. I had that luxury. I said, let's create what you call an episode of care. It's a bid sheet for your colonoscopy, and they wrote down all the things that needed to go into it, and I called them again. Now I can go through, added them all up. The first one was $6,500. The second one was $5,500. I went back to my wife, who also needed one, and I said, this is serious money. Maybe we ought to see if it's any cheaper at home in Utah when we go out to see the grandkids. So we called up a local hospital, and sure enough, it was in the neighborhood of $2,900, which I was gratified by. But then I began to think about something. I thought, I am doing exactly what we can't do, because the first thing I started thinking about is I wonder if there's a big difference between the $6,500 one and the $2,900 one. If you're going to get a colonoscopy, you don't want to cut any corners, right? But I realized by asking myself that question, I was assuming that the $6,500 one was better, when in reality it probably wasn't. In fact, I know it wasn't. Wouldn't it have been a lot better if we had a system that was organized in some part by government and some part by the private sector, where I didn't have to make all those embarrassing phone calls? Wouldn't it be nice if we had a system where there was a standard that I could decide whether one was better than the other? Wouldn't it be nice if they could just tell me the price? If that were the case, we'd begin to see an efficient marketplace where consumers would have engagement. And we wouldn't be hearing the phrase, well, why are you worried? Don't you have insurance? That's what's driving us toward Argentina. It's the lack of consumer involvement and a system that is siloed. The third thing, lack of insurance and siloed. The third problem we have to solve is lack of quality measurement. In other words, we don't make any distinction between that which is high quality and that which is of less quality. And lastly, I'm going to call it chronic more. Everything in the system is organized by you get paid more if you do more procedures. If you are a patient, you have no reason not to want more. You have no real reason not to want an unlimited and the best is defined as the most, and the most is or the most expensive. Those are the basic problems we have to solve. Now, can they be solved? Absolutely, they can. But we first have to decide those two basic questions. How much are we willing to pay? And what role will the government play in doing so? Well, this is a big challenge. These are hard changes. But I would suggest to you that every generation of Americans have faced some kind of hard challenge like this. Now, you might ask, is this as hard a challenge as World War II was for that generation? I'd suggest to you it may be harder, because this is asking every American to make sacrifices and changes in the way they live, to change economic systems and to change the way we treat ourselves, what we eat, the way we exercise, the way we choose. Winston Churchill once said he loved Americans. He loved Americans, he said, because they would always do the right thing after they'd tried everything else. I would suggest that this debate we're having right now is really about trying some other things and moving toward what was ultimately going to be the solution. And ultimately, the solution has to be Americans in their individual capacity stepping up and taking responsibility for some share and having their government use its strong power to organize efficient markets where consumers can begin to make those decisions. They can't now because they don't have the information, and the system is structured in a way that eliminates those decisions for them. We will do the right thing because it is an imperative. I would argue that this is serious change, and we have three choices. And I'll leave you with this. Our first choice is we can fight this need. And if we do, we will become Argentina. We will be overcome by markets. We now have India, China, Vietnam, other countries that are rapidly growing, that are competing to be the #2 economy in the world. We're following a pattern here. The second challenge, the second way we can choose is we just kind of go along, and if we do, we'll be dragged along as the first economy for a long time, but over time we'll survive, but we will not be where we are today. The third choice, and I would argue the best, and the challenge I leave with you today, is that you can lead change, and if you do, you will prosper. And I will argue that this country has always led at a time. Generations have stepped up when they needed to, and they have done what had to be done, and it is now time for this generation to begin to deal with what I believe is its most significant challenge, and that is being willing to deal with its own level of responsibility and to deal with this issue, because if we don't, it will literally erode your future. I have confidence that Winston Churchill was right, that we will choose what is right after we've tried a few things before. Thanks.
We now have a wonderful opportunity to have three other panelists come and join and discuss with Governor Leavitt. I will introduce them in the order that they will be speaking. First will be Dr. Elaine Engelhardt. She is a distinguished professor of ethics and professor of philosophy at Utah Valley University. She has taught ethics, philosophy, and communication classes at UVU for the past 30 years. For the past 20 years, she has written and directed 7 multi-year national grants. 4 large grants are in ethics across the curriculum for the Department of Education, and 3 are from the National Endowment for the Humanities. She is the author of 5 books and the co-editor of Teaching Ethics. She has also written numerous articles. She has served in various administrative positions at UVU, including Vice President, Dean, and Department Chair. Her PhD is from the University of Utah. After her, we will have David Smith. He is well connected to Utah Valley University and has a passion for the school. During his tenure at UVU, he served as senator for the School of Business, and as well as elected to the Vice Presidents of Academics for UVUSA. David was the founder of 2 clubs on campus and has written for the UVU Review. He has served as the state vice chair for the College Republicans and is an enthusiastic political activist. He recently graduated from UVU with his bachelor's in business management and is pursuing a master's degree in statistical economics at the University of Utah. David has been married to his wife for 1.5 years, and he resides here in Orem. It looks like we have Dr. Michael Minch. He'll be our third speaker. He is the Director of Peace and Justice Studies at UVU and a Chair of Philosophy and Humanities Department. He is the co-author with Christian Weigel of Living Ethics and of the Democratic Theory of Michael Oakeshott. He is a democratic theorist and works in the political theory more broadly, including peace and justice studies, especially in conflict transformation, sustainable peace, and human security. He is presently working on a book in democratic virtues. Finally, we have Dr. Greg Craner. He graduated with an MD degree from the Oregon Health Science Center in 1971. He was in the military for 10 years, followed by practice in Oregon for 10 years. He has been practicing gastroenterology with the Central Health Clinic for the past 20 years. He can definitely talk a lot about colonoscopies. He is currently working as the medical director for the Central Utah Clinic. And so each panelist will be given about 10 to 15 minutes to speak in the order that they were introduced. After that, we will have about 10 minutes for them to discuss among themselves some of the questions raised by Governor Leavitt and that they will raise. After that, you will notice that you were given note cards. And that's the opportunity for you as students and faculty and staff to write questions you may have and then deliver them to one of the members of UVUSA. They're wearing black or brown sweaters. And at that time, I'll come up and be able to ask a few of your questions to the panel and have them answer. So let's begin. Thank you.
And would you like us to speak from our seated position or up there?
Yes, let's do that. Stay seated, please.
I will. Thank you so much to Billy Swadley and some of the other student government leaders for inviting me to speak here today. I was so honored when I heard that former Governor Mike Leavitt would be here to talk to us about his views. And I'm very impressed with the things that Governor Leavitt had to say to us. I've put together some thoughts, and since I'm only supposed to take 10 minutes, I thought it best that I would read these to you. So what a beautiful speaking style you have, Governor, and I'm going to read to you and hope you don't mind too much. Well, I believe that health care is a family value. Ethically, it's a fundamental family value to provide access to health care for everyone. It is a family value for everyone, not just federal, state, and corporate workers. It is important for all of us. It is vital we provide health insurance for all Americans. We can't monetize morality. I love studying ethics, and often my study starts with 4 words: harm and mutual aid. May I ask you to consider a simple question? What is the worst harm that can be done to people? If you think about it, it's probably to kill them. How many of you accept that answer? For others, it may be worse if they're kept from proper care for ailments. But when someone dies, there isn't a do-over. We can't re-examine it. It's complete. My friends Matt and Sherry are 56 and 57 years old. A few years ago, Matt had a heart attack and Sherry had breast cancer. Thankfully, both are healthy now, but both are uninsurable because of pre-existing conditions. Both have been laid off from the automobile industry and have no income. They lost their home because of the expensive copays for their insurance and because they had no income. They have moved in with their daughter and her family and live in her storage room. They have no health insurance for their medical problems, and their story is not unusual. For me, the central issue of this forum today is access to health care for everyone. The staggering costs in human suffering and death for millions of people in this country outweigh the benefits of the current patchwork medical system that we currently have. Every industrialized nation in the world except the United States has a national system that guarantees affordable health care for all its system. This is an ethical principle. Nearly all these programs have been popular and successful, but each has taken a drastically different form, and the reason has rarely been ideology. Rather, each country has built on its own history, however imperfect, untidy, or unusual. Ethically, we should all desire a happy life and a life of excellence for all. We want the good life. It is the foundation of our political system. Our founding ethical document, the Declaration of Independence, gives us three wonderful things: life, liberty, and the pursuit of happiness. When you think about it, what do each of these words mean to us? Without health care, many individuals are shortchanged in these fundamental political promises in the United States of America. My friend Pam has worked for many years as a school teacher. She's now 59 years old. A year ago, she had a debilitating bout with a disease, had to stop work for 9 months. Now Pam can't find a job. She can't get health care because of pre-existing conditions. She puts off going to see her doctor, and when she finally does, she has to ask her bishop for the payments. She dislikes this greatly. But we worry about big government. Under big government, we worry what will happen to life, liberty, and the pursuit of happiness if government gets bigger, and this includes health care, as Governor Leavitt pointed out. Our government already includes a common good, and this is big, and as Governor Leavitt pointed out, it includes highway systems, schools, a common defense. Can we individually pay for highways and schools and the common defense? If the government doesn't provide this, could we hope that the wealthy would share the burden of supporting these programs with us? We need our highways, don't we? We also need our health, don't we? I think our health is needed probably even more than our highways. Sometimes it isn't until health is bad that we really appreciate how much we need our health. Well, there is a partial government health care system, and I know it's working. Our Veterans Health Care System is a program of 1,200 government-run hospitals and other medical facilities across the country. It's just like Britain's. We could open it up to other people, or we could give people a chance to join Medicare. That's our government insurance program, and it's much like Canada's program. Or we could provide people with coverage through the benefits program that the federal workers already have. They are lovely benefits. This is a system much like private insurer choices, like Switzerland's. These are all established programs, each with advantages and disadvantages. The veteran system has low costs, one of the nation's best information technology systems for health care, and good quality of care, despite what you may have heard. I've heard very good things and researched good things. And in recent years, the Veterans Administration has come to succeed the private sectors on numerous health measures. But it has tightly limited choices of clinicians. You can't go see any doctor you want, and the nearest facility may be far away from where you live. Well, Medicare allows you to go to almost any private doctor or hospital you like and has been enormously popular among its beneficiaries, but it costs about a third more per person and has had a hard time getting doctors and hospitals to improve the quality and safety of their care. And thirdly, the federal workers approach. They're entitled to a range of subsidized private insurance choices, but insurance companies have done less than Medicare to contain costs, and most have done little to improve health care. Let's look at the ethical good life again. For many of us, the good life centers around love, family, liberty, responsibility, and happiness. In ancient Greece, the good life included making yourself the best that you could be, which would make the great state of Athens good. We need to make this great country of America the best that it can be. I love this country. Well, love is another word that is central to ethics. Part of my ethics system is Christianity. Love is the focal point for me. We are to love one another. It is Jesus Christ's new commandment. We are also to take care of the least of these among us. In Scriptures, we are asked, "Yea, and will ye persist in turning your backs upon the poor and needy, and in withholding your substance from them?" Picture yourself at the pearly gates. Do you think when you meet St. Peter, he will ask you, "Where do you stand when it comes to the size of government?" It is more likely that you will be asked, What did you do for the poor and needy? Matthew 25, verse 34 has always been a favorite of mine. Jesus says, "Then shall the King say unto them on his right hand, Come ye blessed of my Father, inherit the kingdom prepared for you from the foundation of the world. For I was an hungered, and ye gave me meat. I was thirsty, and ye gave me drink. I was a stranger, and ye took me in. Naked, and ye clothed me. I was sick, and ye visited me. I was in prison, and ye came unto me." Then the disciples asked him, "When did we see you like this?" And he says, "Inasmuch as ye have done it unto the least of these, my brethren, you have done it unto me." Presently, more than 45 million Americans lack health coverage. That represents 15.3% of the population. Even more striking is the fact that 90 million Americans did not have health coverage for some portion of 2007 and 2008, according to a recent study by the National Coalition on Health Care. How did we get here? Well, during World War II, the Roosevelt administration had to impose national wage controls to prevent inflationary increases in labor costs. Employers who wanted to compete for the best workers could, however, offer commercial health insurance. That spurred our distinctive reliance on private insurance obtained through one's place of employment. It's been a source of trouble for employers and the unemployed alike that we've struggled with for 6 decades. American healthcare is an appallingly patchwork-together ship with rotting timbers, water leaking in, mercenaries on board, and 15% of the passengers thrown over the rails just to keep it afloat. But hundreds of millions of people depend on it. The system provides more than 35 million hospital stays a year, 64 million surgical procedures, 900 million office visits, 3.5 billion prescriptions. It represents 1/6 of our economy. My son and daughter-in-law are physicians. They gave up their 20s and part of their 30s to train and specialize. This means 12 hours a day, 6 days a week. It also includes at least 1 or 2 30-hour shifts a week. I understand their needs and desires for the good life for their patients. Their tough hours are about learning best how to improve health and lives. Can we all do something today to improve lives? Can we think outside the box and in the spirit of love find a way to provide health care for all? I've had health care at UVU for many years. Those of us who do have health care are paying more and more for it. In the last 10 years, employer premiums have increased 119%, placing a strain on individuals and businesses. That is 16% of the nation's gross domestic product and an increase of approximately 300% since 1990, according to the Kaiser Family Foundation. But I'm grateful I have health insurance. Insurance companies are placing their claims to profit-making over America's claim to health care as a right. System-wide health care costs are escalating. The insurance companies have been profiting as these costs go up. Just check your business pages. Who else is profiting? It's not the payer, and it's not the uninsured. We need to eliminate the high cost of administering policies for many different insurance companies. We need to give the government the leverage to bargain bulk discounts with drug companies and other suppliers. Some elected officials, Democrats and Republicans, think it's more important for them to be reelected than it is for the country to achieve health care coverage for everyone. It isn't. Many years ago, the Reverend Martin Luther King Jr. stated the issue well. Of all the forms of inequality, injustice in health care is the most shocking and inhumane. If we don't pass real health care reform this time around, it will be a moral failure for the nation and a tragedy we will always remember. Thank you.
Well, as Christopher introduced, my name is David Smith. I was a student here up to last semester. I just finished my bachelor's. I'm taking one class here at the time, and doing some prep work as I'm getting ready to launch into a master's in econometrics at the University of Utah. It's a pleasure to be with you. I do want to also echo Dr. Englehart's expression of gratitude to UVU SA for putting this on, especially to Governor Leavitt and for the other panelists for being here today. This is a very important issue right now, and as Governor Leavitt said, it's probably the most divisive issue that we're facing as a nation that we've probably faced in quite some time, and it really does take some real tact to be able to explore some of these things. It's my wish as the only student on this panel to give the perspective of one that's getting ready to inherit this world from my parents. It's a scary world to have to inherit. Our current debt is $12.5 trillion, and as was discussed earlier, will likely surpass $14 trillion by the end of the next fiscal year, not to mention the looming budget deficits. Because of the entitlement programs like Medicare, Medicaid, and Social Security, this number is expected to reach at least $50 trillion by 2050. It's not sustainable. To put this in perspective, our country only produces about $14 trillion in goods and services in a year. America is in a precarious position, and it is us, the current students in this room, that are going to have to clean up the mess. When I examine the Congress for the last 20 years, I'm appalled at the complete inability to rationally deal with the fiscal issues from both sides of the aisle. More recently, it's been abhorrent to watch the healthcare debate unfold the way that it has. It shows me, as a student, that our lawmakers on both sides of the aisle are more interested in their own agendas than the agenda of the American people or the students. For 20 years, there's been no true bipartisanship, compromise, or flexibility on an issue that threatens to destroy the very fiscal fabric of our country. Now, there are many proposed solutions on both sides. On the far left, it's proposed that we engage in a public option, or even just a simplistic takeover of the healthcare system, an extension of Medicare, mandating coverage of all types for all people. Alternatively, on the right side, it's proposed to simply leave it alone, or do simple things like the application of tort reform and just let the free markets work themselves out. I want to advocate that I believe both sides of that spectrum are mistaken. As many of us know, the biggest problem with our system today are the skyrocketing costs and the financial burden imposed on our citizens and on our government. I would submit that the derivatives of our cost problems can be found in our current restricted market system in healthcare. That is to say that the healthcare industry does not operate in a free market system today. Today's healthcare system operates under 50 regulatory regimes with insurers and government, and each state being grossly influenced by lobbies and government setting the rules for the mandates that the insurer must cover. Consumers are completely unable to select their own healthcare plan based on their particular needs. Rather, they have this Cadillac option forced on them by their employers, containing services that in many cases are unnecessarily fueling waste, driving costs upwards, and leading to those egregious profits with some of the insurers discussed earlier. These types of options provide no incentive for the rational utilization of healthcare on the side of the patient or doctor, and costs will necessarily increase. That being said, I would submit that the government has it right principally. We need more competition among healthcare providers. However, the insertion of a public option in a non-free market system will simply not create the type of competition requisite to drive down costs, because the government has never, currently is not, and will never be a fair competitor. One of the many options in this debate is to enable consumers to have the ability to purchase insurance across state lines and to make their selection from the 50 regulatory regimes in existence. This way, a consumer can make a healthcare decision for their family that actually fits their particular needs. This will create hundreds of pools and tiers in coverage. It will operate like any other insurance market. Those who take care of themselves through exercise, proper eating habits will naturally pay lower premium. Those who live abusive lifestyles fueled by drinking, smoking, fast food, and the like will pay higher premiums. Further, costs will be driven down because states will be forced to stop capitulating to special interests in the name of driving additional tax revenues, forcing even the states to have to compete. As options open up, insurance will become more affordable. This could be extended to the currently less than perfect Medicare system through the issuance of vouchers. Applying the same principles, the elderly will be able to select the types of health insurance that meet their unique needs. Subsequently, there should be a repeal of the current tax incentive given to businesses. This tax advantage should be extended to consumers as either an additional standard deduction on their taxes or a tax-free health savings account, the one that Governor Leavitt mentioned earlier. This will provide a necessary disincentive to businesses to provide insurance. As this happens, discretionary of income of consumers will increase as employers now pay out the health compensation to the consumer directly and not straight to the insurer. This additional compensation will assist the worker in paying for their now cheaper insurance. In making these decisions, I think it's important that we pay more attention to our already existent universal health care program of Medicare. Historically, this program does not have a high rate of reimbursement among doctors. It is progressively being rejected by more health institutions, and it does increase the healthcare spending by incentivizing unnecessary visits to doctors. Think for a moment of the current costs of Medicare and the burden that they have imposed on the current cost structure of the system. Then take into account the precarious numbers released by the CBO, Congressional Budget Office, for every single bill that has been discussed on the House floor. Can we honestly know what's going to happen to our cost structure? The government was dangerously wrong about Medicare initially. Even with the alarming deficit implications of current legislation, if the CPO had a consistent error in projection, the effects could be catastrophic. This type of undertaking is way too big for any one bureaucratic entity, well-intended as they may be. If our country is absolutely insistent on an option from the left, then an alternative solution is to leave it to the states to work out their own solutions, as they would choose. Massachusetts has done this already, and yes, they've experienced mixed results. Recently, Utah passed its own version of tort reform, which is certainly a positive step in the right direction. Other states have been walking up to the precipice, and as more states begin various systems of reform, consumers will vote with their feet and select the states with the coverage that best suits their needs. Whatever the solution, we have to take it slow. Not as slow as we have been over the last 20 years, but certainly not the giant leap into the unknown that we're currently considering. It scares me as an American and as a student that our Congress is trying to jam through a law made up of 3,000 to 4,000 pages, a law that many members of our Congress have admittedly not even read. In fact, some have even publicly laughed at the idea of reading it. The bottom line is this. Our health system needs reform, and whatever that solution is must be done deliberately and intelligently. If we do nothing, our country is going to slip into an abyss. If we do the wrong thing, our country's future is bleak at best. If we do the right thing, and we base it on our country's collective value system and the free market system that have provided 2 centuries of economic prosperity, we'll move past the hurdle that has tripped up nations worldwide and continue to build America as the greatest nation on earth. Thank you.
Well, like Elaine, my comments are mostly moral in nature, less technical and economic. Although I'm not as optimistic about the values of the American people as you are, David, apparently, because I think if our values were more what they should be, we would have given attention to this and solved it by now. I appreciate, Governor Leavitt, your use of Winston Churchill. And of course, what Churchill meant is you can always count on the Americans to do the right thing when it's the last resort. And I agree with you, we're there. I agree with you, we're there. I think we've been there for a while. And so I worry about the claims from people who think we're going too fast, the same people who've generally not wanted to go at all for several decades. But I want to say a few things about healthcare as a moral matter. And Elaine, I thought I was the resident theologian here, so I don't have as much to say now because of what you've said. I do want to remind the audience that the United States is a signatory to the Universal Declaration of Human Rights, and the vast majority of Americans do believe that human rights exist, that human rights concepts and human rights discourse means something, that language stands for something real and substantial, and that human rights are benchmarks about how we measure ourselves and what we're doing and what we have yet to do. And remind the audience that Articles 3 and 25 in the Universal Declaration speak to the human right of access to health care. I know when I discuss health care in my classes, many of my students seem to believe that health care should be available to those who deserve it and unavailable to those who do not deserve it. This is a troublesome idea that we divvy up human rights. We divvy up basic necessities of human life among those who deserve and don't deserve those necessities. I know, Governor Leavitt, you preferred the word necessity rather than right, but rights are necessities. The idea of a right is that we have a right to that which is necessary. And most of the world's peoples agree that access to health care is necessary for living a humane, decent, dignified human life. Most of us in this country are willing to pay for other people's children to go to school, for firefighters to put out fires in other people's houses, for police officers to protect other people from harm. We're willing to pay for national parks we will never visit, and roads we will never use, and food inspections for food we will never eat, and air traffic controllers for flights we will never take, for criminals to be prosecuted who will never do us any harm, and so on. We believe in a set of public goods that we share. We believe in a commonwealth where we are willing to pay together the costs of those public goods, where we're willing to take the risks and the responsibilities of sharing these public goods among ourselves without privatizing them. It's curious to me, not at all understandable, why we still yet, so many of us, understand access to health care as a private good. And we are, so many of us, yet unwilling to share the cost, the risk, and the responsibility of that good, just as we are so willing to share the cost, the risk, and the responsibility of so many other goods. I think three questions present themselves to us. They are, why won't we provide access to health care to all? The other question is, why don't we provide access to health care to all? And the next question is, which of those two questions I've just mentioned is the real question? Are we Americans any less capable, any less intelligent than all the other peoples of all the other developed countries on earth? Are they simply better than us? Are they smarter than us? Are they more capable than us? Are they more ethical than us? What is the answer? One last question. Those who do not want to provide access to health care for all seem to me to be afraid of something. I wonder what it is they fear. I don't believe we should create national policies based on fear. We can be bigger and better than that. We need not be so petty, small, cowardly, selfish, churlish, and short-sighted. We are the richest country that has existed in human history. We have the greatest technological and knowledge-based resources for health care. We are, in fact, the very best positioned society on the planet to provide health care to everyone. We used to be a people who asked big things of ourselves, and we did them. We decided to put a man on the moon within a decade without even knowing how that could yet be done. We created a social security system, a highway system, information system, an educational system that were the envy of the world. Why don't we do what we can plainly do? I disagree with you, Governor Leavitt, in this. I believe creating a health care system, I agree we don't yet have one, but we could create a health care system that offers health care to all our citizens. And I think it is rather comparative to what we have done in the past and to what other countries do, a modest thing. It's not the hardest thing we could ever undertake. We can, we should, and I agree, we eventually will, create a health care system where all of us have decent access to decent care. We have to ask some hard questions of ourselves, and the hardest questions are not economic or technical, but they are moral in nature. What kind of people are we? What society do we want to give our children? How can we look at people in need and refuse to share the gracious bounty of gifts that so many of us enjoy? Why are we so afraid? Thank you.